everybody. I'd like to welcome everyone to tonight's program. My name is David Urbach, and I'm the immediate past president of Adath Israel Congregation. And it's my pleasure to welcome you all on behalf of both Adath Israel Congregation and Beth Tikvah Synagogue to tonight's program. I'd particularly like to thank Stan Grossman and Club L'Chaim for their help in finding an excellent speaker and putting the program together. At this point, I would very much like to introduce Dalit Fitchman from Baycrest, who will introduce tonight's speaker.
Thank you very much, David. Shalom, everyone. I'm the manager of major gifts with the Baycrest Foundation. I'm a Sabra from Tel Aviv. Thank you for inviting Baycrest to come speak with you tonight. I will shortly introduce you to Dr. Adriana Shnall, but first just a little introduction about Baycrest. I'd like you to know that I performed a ballet recital at Baycrest as a child. I remember my mother saying, "Ze me'od sameach beBaycrest" in Hebrew, which means Baycrest is a very happy place. I've always kept that in the back of my mind and have been thrilled to be working at the Baycrest Foundation for almost 5 years now. For those who don't know Baycrest very well, I'm going to give you a quick overview. Baycrest got its start more than a century ago, first in downtown Toronto, and then moved in the mid-50s to our campus on Bathurst Street, north of Lawrence. We have a retirement home, an independent living building, a hospital that includes units for rehab, complex care, and mental health. We have clinics of all kinds: hearing, dental, movement disorders, memory care, and much more. And we have one of the largest long-term care homes in Canada, 472 residents. Baycrest is fully affiliated with U of T. We have trained thousands of students, scientists, and health professionals. We are home to one of the world's top research institutes in cognitive neuroscience. Baycrest also powers the Center for Aging and Brain Health Innovation, a solution accelerator that drives innovation in the aging and brain health sector. Baycrest's holistic approach recognizes the importance of families. We help family caregivers with resources, education, and support. Did you know that 1 in 4 Canadians aged 15 and older is a caregiver? And 3 out of 4 family caregivers are also in the workforce, juggling jobs and their care responsibilities. Through our work in research, innovation, care, and education, Baycrest is working to defeat dementia and provide tools to improve brain health for people of all ages and to make the later years the best they can be for grandparents, parents, and families who care for them. I'd now like to introduce Dr. Adriana Shnall. Dr. Shnall has more than 30 years of clinical experience working with older adults and their families in various roles at Baycrest. And she is currently the program director at the Koschitzky Center for Innovations in Caregiving. She has a master's in social work and PhD from U of T and is an assistant professor at the Faculty of Social Work. Adriana is also chair of the Caregiving Committee for the National Initiative for the Care of the Elderly and a member of the Ontario Caregiver Coalition. Not long ago, she received a well-deserved Baycrest Outstanding Innovations Award. Toda rabah. Thank you for listening, and over to you, Adriana.
Thank you, Dalit, so much for that introduction. And, as I'm listening to you, it's funny because you're talking about when you were a kid and being at Baycrest. And I've been at Baycrest well over 30 years. And so I feel like, I've grown up. I've been part of Baycrest for so long now that I kind of identify myself as having, and my kids grew up there in the child daycare, and one of my kids is pregnant, and and my grandparents were there. So it's kind of a family affair for me, and it feels like home. Thank you, Adath Israel and Beth Tikvah, for inviting me to speak today. We were planning this pre-COVID, and it was going to be an in-person, and COVID hit, and then we were back and forth. And finally, today is happening. So I'm very glad to be here and to share my experience, my knowledge, what research says about caregiving, about coping with dementia for families of people that are living with dementia. What we'll do is I'll talk for about 45 minutes or less, and then we'll do a Q&A. And so there'll be hopefully plenty of opportunities for you to ask questions. Today I'll give you a very, very quick overview of dementia. I'll talk about caregiving, and then more importantly, I'll talk about coping strategies. And for me to do that, I'm just gonna let you know sometimes there's confusion around what dementia is and what's the difference between dementia and Alzheimer's disease. And dementia is not an illness, but a syndrome, and it's usually chronic, and actually it's terminal. It's progressive in nature, and it's caused by a variety of brain illnesses that affect memory, thinking, behavior, and the ability to perform everyday activities. And I want you to remember this ability to perform everyday activities, because if you have memory problems that may be common to older age, or if you have mild cognitive impairment, but it doesn't affect your ability to function in day-to-day life, you don't have dementia. And dementia, there's many causes of dementia. And I like to talk about dementia as if saying you have a headache. The cause of your headache could be that you have a fever, you had infection, a tumor, stress. And so there's different causes of dementia. And the most common one, over 63% of the causes of dementia is Alzheimer's disease, which most people are familiar with. Then vascular dementia, frontotemporal dementia, Lewy body dementia, and progressive and the aphasia type of dementia. And the difference between them is that they present differently depending on what areas of the brain the disease starts. So that for Alzheimer's disease is at the back and memory is affected. But if you have something like frontotemporal dementia, maybe your planning on language is affected first, but eventually with all these dementias, regardless of the cause of it, they progress throughout your brain, and it impedes your ability, not just to your memory, thinking, it has personality changes and physical changes as well. And just so that to have an idea, in Canada, we have over 500,000 Canadians living with dementia. And by 2030, so that's only in 8 years, the numbers will almost double, not quite. The other thing is it's a triple threat for women. So 65 of those diagnosed with dementia over the age of 65 are women. Women are also, most of the caregiving is done by women in dementia care. And women in healthcare tend to be the ones that look after people with dementia as well. And like Dalit said, that 1 in 4 Canadians are caregivers at some point. But interestingly, 1 in 5 Canadians have experienced caring with somebody living with dementia. So that's a pretty high number. The other thing that's important for all of us to remember is that 75% of all impaired older adults rely only on the assistance of family and friends. I mean, that's huge. Families provide between 5 to 20 hours per week of care while fulfilling other roles. And we have the typical sandwich generation. We have adult children that have their own children, that have full careers, that are looking after parents, perhaps. And the other thing that's important to note is that the average of people that are caregivers of people with dementia that suffer from depression is 22%. And these are older adults, but in the average population of older adults, only 11% of older adults have depression. So when we intervene for helping people cope, manage the dementia, we have 3 areas that we intervene in. So one is the patient, or we call them care recipients. And that would be things like pharmacological interventions, non-pharmacological interventions, things like music therapy and day programs, and that's important. Then we can also intervene in people's social, physical environment. So that's attending a program, going into a long-term care facility, adapting somebody's environment so it's less stressful. And that also matters. But the third one, and the one that I'm going to focus on today, is how do we help caregivers? How do we help people cope with the demands of looking after somebody with dementia, which could last like over 20 years? We've had patients that, I mean, when I started at Baycrest in 1990, and that were that I was following for like literally 20 years. And so how do these families cope? And how do we help people manage this kind of roller coaster that living with somebody with dementia creates for us? So what's important to know is that the most effective treatments target more than one area. So sometimes it's medication, sometimes it's non-pharmacological interventions, also putting in respite, a day program, and also supporting the caregiver. And all of these interventions at the end of the day not only affect the person living with dementia, but also the caregiver. And just so that you know, if caregivers are not doing well, they're depressed, they're overwhelmed, so are the people living with dementia, the people that they care for. There's a direct correlation between that. So it's important that we look after everybody. So I'll focus a little bit about family caregiving. And just so that you know, when I talk about caregiving, there's some controversy around the term caregiving, because what it means is that if I'm the caregiver, I'm giving care to somebody else. And we know it's not a unidirectional thing. I may be caring for my mother, but in return, I get love, I feel good about myself, and I still have a connection with her. So it's both ways. So some people prefer the term carer, and in the UK, in Australia, that's the term that's used. And a lot of other people use care partners to really talk, to show that there's a partnership between the care recipient and the care provider. At the end of the day, I'm not very particular about what language we use. I use caregiver, not because I like it, but because it's the term that most people recognize, so that when I'm talking to other people, they know what I'm talking about. The other thing I want you to understand then is that when we talk about family, is not just your parents, your spouse, your children, is whatever definition of family people choose. So sometimes it's family of choice, neighbors, friends, it doesn't matter. The other thing I don't like to use is the term your loved one. And we hear this constantly, where people will say, oh, you're caring for your loved one. And I'm very careful with that, because I'm very aware that some people don't love necessarily the person they care for. They do it out of duty, out of respect. Sometimes these have been relationships that have been strained, and we still have a duty. And we don't have a duty, actually, it's a choice, but there's a filial duty in our society, in our culture. We expect families to look after one another. And so if we use the term loved one, we're passing judgment on people. And some people may feel really bad that they don't love their mother necessarily, especially in the context of abuse, a more difficult long-term situations where there's been struggle. The other thing I want to talk about quickly is that a lot of, especially adult children, talking around, this is a role reversal. Now I'm looking after my parent like my parent looked after me. And I want you to know that it's never a role reversal. In all my years of practice, when you have adult children, no matter how successful in their 50s, 60s, 40s, families are of their own and careers, when it comes to their parents, we all behave like children. And so it's not a role reversal, but yes, we're looking after and providing care sometimes to our parents. And caregiving, although there's a lot of positives to it, there's a lot of stresses that come with it. And a big one is the social isolation. And especially we saw this during COVID, where people couldn't go out. And even when it's non-COVID times, if you're busy looking after somebody, it means that you're not going to other places, you're not necessarily seeing friends, you're not joining other activities. The other piece that is stressful, as I was talking before, are the dynamics of prior relationships. So those difficult relationships that we had in the past may really play into what's going on right now. So for example, siblings are helping look after parents where there was a lot of fighting before and jealousies. Those don't go away. And again, in my office, I would see mature adults, 3 adult children that would be fighting like 2-year-olds when it comes to talking about their parents. And that plays an impact into how we manage our caregiving duties. Also, the quality of the previous relationships. So if you have a couple that was never a happy marriage, and now one partner develops dementia, this feels like the icing on the cake. And it's very different for couples and relationships that were close. There's a sadness and grief that comes along with having your partner develop a dementia. But at least there's a love there underneath and memories and a history that help people move through the caregiving trajectory. It also matters how old you are in this stage in life. So there's people, about 5% of the people with dementia have younger onset dementias, which means people that develop symptoms under the age of 65. And could you imagine if you're 50? And your partner develops a dementia, you still have children in the home, you have a mortgage, you have kids in university, you can't work because you develop a dementia, you may not necessarily have income. The partner that was working has to quit to look after the person who's ill. The impact there is very, very different than if your partner develops a dementia and you're both 85. The other thing is that one of the biggest stressors in dementia caregiving is this ongoing sense of not knowing what comes next. Even if you know the textbook case is what happens after, you have memory loss, is this constant people report and research shows this it's kind of like a big roller coaster and you don't know what comes next. Is my partner gonna go out in the middle of the night? Is my mother now gonna stop eating? Is my father now gonna fall and break a hip? And how do we manage him in the hospital and COVID and dementia? And COVID has put another spin to it because in terms of visitation rights and the roles of families, which is a whole other talk, the role of families in long-term care, and even in the health through healthcare. And the other biggie one for families is finances. It's not a cheap illness to develop. People need care. Unfortunately, our government supports are minimal at best, even though there are some supports. And if somebody needs care in the home, that's very costly. Even if somebody needs long-term care, that's costly as well. And although there are many benefits and positive things around caregiving, I don't want you to think that it's all bad, it's all negative with negative outcomes. Overall, it's not something any of us would choose. And there's a reason for that. It is very stressful. And there's increased psychological distress. So a lot of people report anxiety, depression, and burnout. And remember, this is over a long period of time generally. So it's not something like quickly that develops like a cancer. Well, that's not a good example, but say You fall, you break a hip, you have surgery, and if you're not elderly and have other complications, you heal for a while, you have your rehab, and then you go back to normal. This is something that is going to get worse, and this is going to something that's going to last years. And so it's not easy to manage this for such a long period of time. And so it's not uncommon for us to see family caregivers that die before the person with dementia. There's an increased risk of mortality. There's an overall decreased quality of life. And newer research actually shows, and this is the scary piece and why we must all look after ourselves, is that family caregivers of people with dementia are at 600% increased risk of developing dementia themselves. And so even if you don't care about looking after yourself for the sake of the person you care for, the way it affects us is huge. It has really a tremendous impact. And so it behooves us to really think twice about how much do we matter and how much are we going to do for ourselves to try to prevent having this increased risk of dementia. Unfortunately, caregiver stress can be prevented or reduced. I mean, I'm being very optimistic to say prevented, but it could be reduced if people are aware that they're in the role of caregivers and if they avail themselves of appropriate interventions. So what do we know about what the research shows? That these are the areas that we must support caregivers in. So we must help caregivers increase their competence or ability to manage the illness. So they need to learn about how to be a caregiver. We need to teach them. We need to provide information that is based on evidence. So not Dr. Google, but really support them with information that is really current, that is appropriate, and that it's something doable. So for me to say, unless you start running marathons, you're not gonna be okay, nobody's gonna do that, right? So it needs to be information and that makes sense, that is relevant and appropriate for people. We need to teach people to problem solve. Because one of the things about being a caregiver of somebody with dementia is that problems come up. So today, the person you care for had trouble eating, and you need to figure out, how am I going to get food into them? Do I need to chop it up? Do I need to cut it? Do I need to give something different? And then you resolve that issue. And then the next month, the person you care for wanders. And so how do I deal with that? Sometimes people with dementia become aggressive, or they become apathetic, or they become very anxious, or they just sing nonstop, and it drives you nuts. So we have to teach caregivers how to problem solve as these issues come up. And we do this through what we call psychoeducational interventions. So it's not just teaching and education, but we need to help people understand their feelings. We need to I'll talk a little bit more about this. We need to let people grieve, know what they're going through, because unless we can work through those feelings, all this education is not going to help. The other thing is we need to help people navigate the healthcare system. There's supports out there. Nobody knows how to find them. I've been in this business for over 32 years. I still have difficulty finding some of these resources. And we need to be able to then link caregivers to these appropriate resources. So I want to focus now on very concrete ways to help people cope with dementia caregiving. And as I cannot say this enough, is that it takes a toll on people. It's not easy, and you can't underestimate the toll it takes. The other thing that I want to say to you, that no matter what I say to you today, I don't ever want you to feel that there's a right answer for anything, because there isn't. There's no right or wrong way to be a caregiver, and don't let anybody tell you otherwise. We all muddle through life the best we can. Feeling discouraged, sad, lonely, frustrated, confused, angry is normal. We cannot fight these feelings. Every situation is different, so there's no recipe that works for everybody. The other piece is that you have to give yourself credit for doing the best you can under very difficult circumstances. So be kind with yourselves. And there's no magic trick to make a difficult situation easier, but there are some strategies and supports to be able to cope better. And I want you to remember this, because if after today's webinar, at least you get one little bit of information that may be helpful for you, I'd be happy. Because it depends. All this advice depends on your situation. And so the first thing that is crucial for family caregivers is they need to recognize the signs of stress. But people are not used to understanding what these feelings are like. Especially older adults grew up kind of with this idea that depression doesn't exist, just get it together, do the best you can, don't worry about, just keep going and be strong. Younger generations, now people talk about mental health, they're very open about their feelings, but not everybody's comfortable. And not everybody, never mind comfortable, but not everybody has the language to talk about feelings and know how they're feeling. And so, and it's not just feelings, but there's also sometimes physical signs like trouble sleeping, feeling exhausted, health problems, heartburn. A lot of people talk about anxiety as I'm nervous, I have this nervous feeling, and that they can't put their finger on. But these are all examples of stress. And so today I'm going to share with you, and I'm so aware of the little time I have with you, so we'll see how far we get, about strategies for coping. And the first strategy for coping is don't bury your feelings. Your feelings are there to help us understand what we're going through. And so if you're angry, try to do something with that anger. Clean a closet, take a walk, talk with somebody, acknowledge that you're angry first, and try to do something that helps you. Somebody like me, I'm a runner. When I'm angry, when I'm anxious, I just have to, my family knows, is like, she's got to go for a run. But we know what helps you. I mean, we each have our ways of coping. I don't like to clean my house, but my best friend, her biggest, when she's angry, when she's upset, when she's frustrated, she goes in a cleaning frenzy. It's just understanding what works for you. When you're frustrated, stop what you're doing, take a deep breath, and perhaps do something different. Also understand your limits. You need to take care of yourself. You cannot do it all. Make mistakes. We always talk, there's research that neurotic personalities have a hard time with caregiving in many ways, because we just worry about it. And I say we worry about a lot of things. Grieve. It is normal to be sad that things are not the way they used to be. But also, just because you're grieving, it doesn't mean that you cannot be happy or love and laugh. This is the time to make meaningful connections and to enjoy, even if there's small bits of happy times with others. And let's not lose hope, because even hope about small things, like maybe tomorrow it'll be easier in the morning, he'll be okay having breakfast. Maybe tomorrow a friend may call you. And big hope, Like maybe there'll be a treatment or a cure that we can find tomorrow. So there's strategies we can use to reframe our thoughts, and really how you think, how we think affects how we feel. And we're not our thoughts. So it's important to learn how to manage these. So for example, when we're driving in the morning, we're late for work, and some car cuts us off or cuts the person in front of us. And in our mind, we're thinking, why do they think they're more important than us? How dare do they do this? Didn't they know they should go in the slow lane? Like, I've been waiting for a long time here, and we just escalate and escalate. There's something called, I call it API, assume positive intention. What if we change the way we look at things? And instead of me being angry at that person, thinking that they're so important that they can go ahead of us, thinking maybe they're really, really late for an important interview. They haven't had a job in 2 months, and they had this interview, they had a flat tire. Then I don't have to be angry, because there's a reason why that person cut me off. At the end of the day, it doesn't really matter why the person cuts you off or not. What matters is our reaction to that. And so learning how to always assume positive intention on others will make our lives easier, will make us less stressed. Another way we can reframe our thoughts is labeling, how we label. So for example, it's the end of the day, you've been looking after your partner, you've had all these things on your plate, and you're just too tired to do another load of laundry. And you think, I am so lazy. Are you lazy? Or could you have a more compassionate response, like, I'm not lazy, I've been working so hard, even I need a break sometimes. So how we talk to ourselves and reframe our thoughts makes a difference. The other thing is jumping to conclusions. We all think we're mind readers. So we always tend to assume that others are thinking negative thoughts about us. For example, your daughter doesn't return a phone call, and you assume she's ignoring you, she doesn't love you, she doesn't think about you, and you start kind of spiraling. A more compassionate response would be something like telling yourself, I don't know what my daughter is thinking. For all I know, she didn't get the message. Maybe she's busy, or she just forgot. If I want to know what she's thinking, I will have to ask her. So when we shift our mindset like this, we stop escalating and we stop ruminating about these things. The other thing we're really good at is fortune telling. We can all tell the future. So we can predict a negative outcome in the future. So for example, you won't ask your son for help because you know that he's never going to do that, and there's no chance that he'll help you. Perhaps a more compassionate response would be something like telling yourself, I can't really predict the future, and I don't think he's really going to want to help me, but I won't know for sure unless I ask. And think of that difference. The other thing we're all experts is we all overgeneralize. So we take one negative situation and we multiply it. So for example, getting ready to go to work and you discover that your car battery is dead. And you conclude, this always happens to me, something always goes wrong, and we catastrophize things. If we shifted the way we think or talk to ourselves, like, the truth is this does not happen all the time. Usually my car works just fine. At times things don't happen the way I would like, but sometimes they do, and most of the times they do. So again, it's keeping things in perspective. The other thing is discounting the positives in life. You overlook the good things about your situation and yourself. So for example, You may not allow yourself to feel good about a Shabbat meal you cooked and think, you had the whole family over and you said, I could do better. The food was overcooked and the kids were all fighting. And you get down on the fact that you didn't throw this spectacular meal when all the family was together and the food was delicious and everybody was getting along. A more compassionate response would be making Shabbat meals for the entire family while looking after my husband is not easy. I'm happy that I was able to host dinner tonight and that my family's growing. So again, it's telling ourselves, like, why are we thinking the worst? Why are we telling ourselves we're no good? Instead of looking at the positives about the things that we're doing. The other thing is asking for help. Caregivers typically do not like asking for help. They find it hard. A lot of people feel that they should be able to manage themselves. And they actually feel that no one will help them, even if they ask for help. And a lot of people feel that it's not right to leave the person they care for with somebody else. How do we ask for help? An easy way to ask for help is to be specific. So, for example, I would ask my neighbor, do you mind walking my dog today at 7 o'clock? Because normally he goes for a walk at that time. Today I'm giving a talk and my husband needs care. So be specific about the kinds of asks that you have of people. And of course, it's scary to ask for help because the possibility always exists that the person's going to reject us and say no. And then we take that personally. But again, if somebody says no to our request, again, think of it. Maybe my neighbor's really busy and she has her hands full and she's not doing it saying no to me personally. She just cannot take one more thing. So again, trying to not take it, it's not a reflection on us. There's things like joining a support group. That's always very helpful to have people in the same boat that you're in. And a lot of groups at Baycrest meet in person or online, and there's separate groups for family, spousal caregivers and adult children caregivers, because we know that their needs are very different. Ask for help, ask your family doctor, check online for organizations that are local to you. In your case, it would be Baycrest. Or there's Circle of Care, and there's other facilities as well, and organizations. This goes, when I was talking about self-talk, the way we talk to ourselves, saying kind things like, I'm doing the best I can. What I'm doing would be hard on anybody. I'm not perfect, and that's fine. And some of the things that happen, I can't control. And sometimes I just need to do what works right now. It may not be the best thing, but this is what I need to do this time. Sometimes it's understanding that the person, so for example, if you're an adult daughter looking after your mother, and you go there and you're trying to get an outfit for the family wedding that's happening the following weekend, and your mother is like, this garbage, what kind of an ugly dress you got me, I'm not putting this on, and starts acting out. You have to separate your mother from the illness. Without a dementia, Alzheimer's disease, whatever's that your mother would have, she would not be acting in this manner. So that it's the illness doing this, it's not your mom. And sometimes it's just acknowledging that you can enjoy moments when you can be together with the person you care for in peace. And if things become too difficult, saying to yourselves, I may need to get a counselor, somebody to help me. The other strategy that is helpful is understanding that it's not all or none. So we need to practice both and thinking. And an example of this is, I'm both a caregiver and a person with my own needs. You're not just a caregiver, and you can take care of both the person you care for and yourself. And that two opposite thoughts and feelings can coexist. So you can both wish that this would be over. This caregiving business is a nightmare. I can't take seeing my husband this way. And at the same time, want them to keep on living. And that's okay. It's being able to live with two opposing thoughts that's so hard for most of us. And you can be both sad at, say, my husband's illness, but be joyful with a new grandchild. And you can be both sad about lost hopes that you had about what things would look like when you grew old together and you're going to travel and all these things, and still be happy about new plans and goals. I'm just very mindful of the time. And so the one thing I really, I can't emphasize this enough, and it's easier said than done, is this idea of replenishing ourselves. And again, goes back to the beginning of today's conversation when I was saying, know thyself, know what moves you, know what gives you energy. We need to unplug. You know, when your laptops, when your phones freeze, what do? We reboot them, we plug them. But we don't do that with ourselves. And so think of yourself as a phone that needs rebooting, a phone that needs energy, it needs to be plugged in. And if it doesn't, and when the charge is lost, the phone dies. And in many ways, we're no different. We all know we need to eat right, exercise, get proper rest. It is hard when you're a caregiver, especially if you live with the person with dementia. I'm not underestimating that, but still find small things that you could do that recharge you. And finally, it's important to learn about the effects of dementia. Knowing what to expect, knowing some of the symptoms, helps you understand what's normal and what's not normal. Understand who can help you. Which professional do you call when things happen? Try to let go. If you know that people with dementia, and it's at some point may forget who you are, let go of the unrealistic expectation that tomorrow morning your husband's going to say, "Hi, honey. Hi, Adriana. How are you?" Because they may not. And so you'd be disappointed every single morning, hoping that this would happen when it's not going to happen. And really understand that a positive attitude can really change a bad day into a better one. And so I go back to this slide I shared with you earlier. Again, there is no right or wrong way to be a caregiver. That having emotions like sadness, loneliness, frustration, confusion, and anger is normal. Every situation is different. And not that even every situation is different. Every day is different. Every hour is different. Give yourself credit for doing the best thing that you can, that you're doing under the circumstances. And again, there's nothing magic. Nobody's going to give you a list of top 10 things you must do to make life easier. But there are supports and there's strategies to help you cope better. And I always talk about in dementia caregiving, there's never a clear path. And it's basically having to learn to walk in the fog, trusting that if we keep moving forward, despite the stresses of really not knowing what lies ahead, we can still reach out to people, have supports, have human connections, and stay resilient and strong. I'm going to stop sharing. I'm just very mindful of the time. And just so that you know, Baycrest is available for supports. There's Baycrest at Home, and that's Baycrest at Home. It's spelled Baycrest, A-T, home.ca. There's also, I lead the Koschitzky Center for Innovations in Caregiving. We have a wealth of webinars on all kinds of different topics related to caregiving that may be of interest to you, from powers of attorney to dealing with grief to dealing with abuse. We have one on June 15th. June 15th is World Elder Abuse Awareness Day, and these scams that are happening. But I'm not saying it to promote it. I'm saying that there's a lot of resources for you on articles that may be of help, and also through the baycrest.org website. I'm going to stop right now and just open it for questions.
Thank you so much, Adriana. This was quite enlightening, I have to say. I'm at the start of my caregiving journey. Now I understand what it means to be part of the sandwich generation. It's hard to watch your parents age and need help, whether it be because they're suffering from dementia or some other ailment. And you're right, nobody teaches you how to do this. So I guess my question is, I guess we're not really given a choice. We're kind of thrown into this position. And at what point is it okay to say, I can't deal with this, we need professional help?
So that's a good question, in that, when do we need help? At what point? And again, it differs for different people. You know, we all have different points of where something happens that we can't tolerate anymore. And we're all different. Some people are planners and they want control and they want help right away and they want to put everything in place, and because that's the way they cope with life. And sometimes things just happen. So what tends to happen is small problems. So for example, initially, a few times, say that your parent, you get a call from the bank, you know, it's really strange, your parents were always on top of things, and now there seems to be a problem here. Do you know what's going on? And then a month later, a parent falls, breaks a hip, but they muddle through it. And 5 months later, he gets lost. And then 1 week later, he gets lost again. And then 2 days after, he falls and breaks the other hip. So it tends to be that these crises that happen, you know, once a year, twice a year, 4 times a year, once a month, 5 times a month, at some point they become so frequent that you can't ignore it anymore, right? And that you can't, it's like something's got to give. But that, you know, depends on the family, on the resources. Some people, from the moment something goes wrong, they go all in, they want to speak to somebody, they want to put a plan in place. So I think for those of you that are women, when people ask that question, people also ask, when's the right time to place your parent? Because that goes hand in hand. When do I know it's the right time to place my parent or my partner? When is the right time? It's kind of like for women, like saying, how do you know when you have to give birth, when the baby's coming? You kind of know, you know, like something happens that you kind of got to push. Something's got to give. The baby's coming no matter what. And I cannot explain it in any other better terms, that at some point people hit something that this is as far as they're going to go, and now they need help, or they need placement, or they need whatever. Of course, in an ideal world, we should be planning ahead of time, have our legal affairs in order, powers of attorneys, will, plans, people's wishes around advanced care directives. What are your wishes? Do not resuscitate orders. Have all those things, these discussions early on. Financially, I mean, those that have financial resources fare better just because you can afford to hire somebody. Although in these days in healthcare, even if you have money, you can't hire anybody because there's no healthcare providers to be had. But planning makes a difference. And then when I say each situation is different, because each situation is different, because say, for example, Gail, and I don't know your family and I don't know you at all, but you have a sister that looks at things totally opposite from you, and a brother, I always call it the brother from California that dictates orders but is never around, right? And so you say, I think we need to get help for mom and dad. And your sister says, no, they're totally fine. And your brother from California says, guys, you do nothing. You live in Toronto. If I lived in Toronto, I would be doing groceries. I would be doing this and that and that. What's wrong with you? Right? So it depends on the family situation as well. And so the first thing in an ideal world is getting the family together to at least get everybody to agree on a plan for the person that needs care. That's step number one. And sometimes some families can do that, and most families can do that on their own, but some families need a social worker, a counselor, or somebody else to help them with that. So I don't know if I answered your question. That was long.
No, thank you so much. And I do have a sister and I do have a brother, but my brother we're all in Toronto, so good call.
Yeah.
Someone here has a question. How is technology changing to help caregivers and people with dementia?
Well, hugely, in that, I mean, I shouldn't say hugely. Technology could be a source of support and it could be a source of anxiety. So there are all kinds of, you can go to Costco, to Best Buy, and I'm not endorsing any of these places, but they sell webcams and they sell different, I call them gadgets, to see if there's a flood, if the person's in the bed, if the person's opened the door, if the person's opened the fridge, and keep an eye on things. And the app keeps sending you information around your mother's up, your mother's down, she's gone to bed, she's watching TV, increasing your anxiety and not really helping you. So that's a negative use of technology, the way I see it. Then there's things, so I'm working on we got a grant, virtual reality for supporting caregivers, teaching them how to cope with dementia. This is a technology that potentially will help people that can't come on site, people that live in rural areas, have training that they cannot have in person, for example. We have technology, even simple things like during COVID, having FaceTime, having Zoom now. We do all our counseling sessions over Zoom. That's technology that's helping family caregivers. We have a lot of information online. And then we have fancy robots and things that could empathize with people. So it's a huge topic in terms of how does technology, we have day programs. So through Baycrest at Home, for example, now, the day program, which had closed down during COVID, was sent to people's homes, and there was exercise classes, art classes, and all things through the use of Zoom. So this is a huge expanding area of care, and we could do a whole other lecture webinar on technology, but it's using it properly. I mean, that's the key. It's using technology in a way that's helpful for you as opposed to stressful for you.
Okay, let's see if anyone, just a reminder, if you have any questions, we are going to end shortly, but I wanted to make sure we answer everyone. 1 second, let me look in the chat. We do have someone who's written, my struggle is that my mother was always angry, belittling, ungrateful, yelling, etc. It isn't her dementia, it's her personality. She has no one else to help her, and when she starts to yell, I can't handle it, and I need to take a break from her, but I can't because there is no one else. That's a difficult situation.
Very, very true. I'm very common, actually, situation. It feels like it's not common. So, when I talked about the quality of the previous relationship matters in terms of how you cope, the fact that it was not a close, loving relationship, that your mother was not this nurturing, warm, loving person to begin with, makes it more difficult to care for somebody like that. And partly is coming to terms with the fact that this is who your mother was. It's not the kind of mother you would have chosen for yourself, but this is what is in reality. And she still needs the care. And dealing with the anger. I mean, you can't suppress that anger that you feel, but trying to be compassionate with yourself. And when you lose it, understanding why. And sometimes it's, you can't do it all. And I'm not saying, because most of us can just say, forget it, I'm not going to look after you, but finding compromises and knowing that if she starts up and he pushes our buttons, that we have to leave. And understanding and being very clear, I'm doing this out of filial duty for my mother, not because of love. I wish our relationship would have been different. And acknowledging the sadness that comes with the fact that she was never a nice person. And this is the icing on the cake. And this is when I talk about these more conflictual relationships make caregiving that much more difficult, and counseling for yourself, like knowing what belongs to you, and why you're doing what you're doing, and putting it in perspective. But it is very, very hard. And being the only person makes it that much harder. You can't share the responsibility. So it is very, very tough.
We have another question here. How can I tell my daughter she shouldn't correct her father with Alzheimer's about petty things like what day of the week it is?
So one way, and that's again, it's this coming to terms with, you're going to fix the person, you're going to remind them. And that's education, really. That's really around. And one of the things that works for people is saying, especially in Alzheimer's, when somebody has Alzheimer's disease, they may forget things, but feelings still exist. So I can, if you put me down because I say something incorrectly, or you ask me a question and I can't come up with a question because I have Alzheimer's disease, I feel bad about myself. And the worst part about that is then I feel bad, but I can't even remember why I'm feeling bad or sad, because I forget that I forget, and I have a memory problem, right? So then I'm teaching your daughter that it just makes him feel bad. It doesn't help him remember anything better. And now he's sad, or he's feeling bad about himself, and he can't even remember why he's feeling bad. And the goal is to try to help people feel good about themselves. Give people, because at least that piece, that the feeling component of it stays the same. So we're always trying to make people feel good, make them feel, because if they feel better, then we feel better. That's the other piece of it. Because if then the father's agitated because he can't remember, he's sad, it puts everybody in a bad mood. The visit from the daughter is terrible, and it's frustrating and painful. So it doesn't help anybody. So it's education, but understanding what the consequences of pointing out that they have a memory problem is not going to get anywhere, because the illness, it's the illness.
Thank you, Adriana. I'm now going to call upon Anna from Adath Israel to conclude.
Great. Thank you so much, Gail. My name is Anna Ginden, and for those of you who don't know me, I'm the Director of Programming at Adath Israel Congregation. And I wanted to thank Adriana for coming and speaking with us today. I know I've learned a lot. I'm sure you all did as well. Thank you so much, Gail, for doing all the questions, and good luck in your journey, and good luck to everyone on this not easy journey, but something you can't really avoid. And thank you for everyone else who's joined us tonight, and we look forward to many other programs at both Adath Israel and Beth Tikvah.